Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that examines the effects of a very commonly used medication in our feline companions, prednisolone. This research, published in the Journal of Veterinary Internal Medicine in 2024, sought to understand how this corticosteroid, frequently prescribed for its anti-inflammatory properties, impacts the levels of certain enzymes in the blood of healthy cats, specifically those related to the pancreas. Corticosteroids like prednisolone are a cornerstone in the treatment of various inflammatory conditions in cats, and there's increasing interest in their potential role in managing feline pancreatitis. Pancreatitis, an inflammation of the pancreas, is considered a common condition in cats, although precise data on its prevalence are still lacking. Diagnosing pancreatitis in cats can be challenging. The clinical signs are often vague and nonspecific, and getting a definitive diagnosis through tissue sampling is highly invasive and doesn't necessarily offer immediate therapeutic benefits. Furthermore, it can be difficult to get a complete view of the entire pancreas using ultrasound imaging. Because of these challenges, measuring the levels of lipase, an enzyme produced by the pancreas, in the blood has become increasingly important over the last 15 years. These measurements come in two main forms. One that measures the activity of the lipase enzyme using a specific substrate called 1,2,O-deloryl RAC glyceroglutaric acid-60-methylresorphin, ester, often abbreviated as DGR in scientific circles, and another that measures the amount of pancreatic lipase protein present, known as pancreatic lipase immunoreactivity, or PLI. These two types of tests have largely taken the place of tissue sampling as a key indicator for diagnosing pancreatitis in cats, and they generally show a strong correlation with each other. While the effects of corticosteroids on various routine blood tests in healthy cats have been previously investigated, their impact on these crucial lipase measurements has remained unknown. Therefore, the primary objective of this study was to evaluate exactly how administering prednisolone affects both lipase activity and pancreatic lipase immunoreactivity concentrations in healthy cats. Additionally, the researchers measured serum amyloid, an important marker of inflammation in cats, to closely monitor for any signs of steroid-induced pancreatitis. They also measured cholesterol and triglyceride levels, as elevated blood fats have been implicated in both causing and resulting from pancreatitis in some species. The researchers hypothesized that a short, 7-day course of prednisolone, given at doses intended to have an anti-inflammatory effect, would not significantly alter the results of these lipase tests. Now, let's turn our attention to the findings of this study. 7 clinically healthy cats, ranging in age from 4 to 7 years, participated in the research. These cats underwent thorough physical examinations, and their initial blood work was all within normal limits. Over a period of 14 days, the researchers collected blood samples at specific time points, before the first prednisolone dose on day 1, and then on days 2, 3, 8, 10, and 14. For 7 consecutive days, from day 1 to day 7, the cats received prednisolone orally at a dose of approximately 1.1 to 1.5 milligrams per kilogram of body weight. Throughout the study, the cats were closely monitored daily for any signs of illness, and their body weights were recorded. The initial baseline measurements on day 1 showed a median lipase activity of 22 units per liter, with a range from 14 to 52 units per liter, and a median pancreatic lipase immunoreactivity concentration of 3.2 micrograms per liter, ranging from 2.3 to a notably higher 15.7 micrograms per liter. Interestingly, one male cat exhibited these elevated baseline values for both lipase activity and pancreatic lipase immunoreactivity. When researchers looked at the changes in lipase activity and pancreatic lipase immunoreactivity concentrations over the course of the study, they found that there were no significant differences across the various time points, regardless of whether they included the cat with the initially high values in their analysis or not. All the cats remained clinically healthy throughout the entire study period. Further analysis revealed a significant positive correlation between the two different lipase tests, meaning that when one test showed higher values, the other tended to as well. Regarding the other measurements, the study found that triglyceride concentrations significantly increased while the cats were receiving prednisolone, and then significantly decreased once the medication was stopped. Similarly, cholesterol concentrations were also significantly higher on day 8. However, for the most part, these changes in triglyceride and cholesterol levels remained within the established reference intervals for cats. Importantly, the researchers found no significant correlation between either the triglyceride or cholesterol concentrations and the results of either of the lipase assays. In the cat with the consistently high lipase and pancreatic lipase immunoreactivity levels, triglyceride and cholesterol concentrations remained within the normal range throughout the study. Serum amyloid A concentrations, the marker of inflammation, were mostly below the level of detection or within the normal range in the majority of the cats during the study. The cat with the elevated lipase and pancreatic lipase immunoreactivity had slightly elevated serum amyloid A at the beginning of the study and on day 3, but these levels were not markedly high. One cat showed a sudden, sharp increase in serum amyloid A on day 10, 2 days after the prednisolone was stopped, but all other clinical signs and laboratory results for this cat remained normal, leading the researchers to speculate this might have been due to a minor injury that went unnoticed. Now, let's discuss the implications of these findings. The key conclusion of this research is that short-term administration of prednisolone at anti-inflammatory doses does not significantly increase serum lipase activity or pancreatic lipase immunoreactivity concentration in clinically healthy cats. The researchers emphasize that these results are important because prednisolone is so widely used in cats for various inflammatory conditions and is being considered more often as a treatment for chronic pancreatitis. Additionally, pancreatitis often occurs alongside other inflammatory conditions like cholangitis and inflammatory bowel disease, where prednisolone is a common treatment. Knowing that prednisolone itself doesn't typically elevate these lipase markers in healthy cats is valuable because in everyday veterinary practice, an increased lipase level in a sick cat might automatically lead to a suspicion of pancreatitis. The findings of this study align with previous research conducted in dogs that also showed minimal or no significant increases in lipase activity or pancreatic lipase immunoreactivity with prednisolone treatment at similar doses. The study also confirmed a positive relationship between the two different methods of measuring lipase, although this correlation was somewhat weaker than what has been observed in cats suspected of having pancreatitis. The researchers suggest this difference might be because their study involved healthy cats. They also touch on the ongoing discussion about whether lipases from outside the pancreas could affect the lipase activity test in healthy animals. But they argue that changes within the normal reference range are unlikely to be clinically meaningful. The researchers also address the recent changes in how pancreatic lipase immunoreactivity test results are interpreted. The reference intervals have been updated, leading to higher cutoff values for diagnosing pancreatitis. However, the authors point out that these new guidelines do not alter the conclusions of their study, as the changes in lipase levels they observed were not substantial enough to cross these new diagnostic thresholds in healthy cats. The study did observe a temporary increase in triglyceride and cholesterol levels during prednisolone administration, which is a known effect of this medication in cats. While elevated blood fats have been linked to pancreatitis in some cases, the researchers in this study found no correlation between these lipid levels and the lipase measurements. They suggest that perhaps more significant elevations in blood fats might be necessary to see such an association. The case of the one cat with persistently high lipase and pancreatic lipase immunoreactivity levels is also discussed. The researchers believe it's unlikely that prednisolone caused these elevated levels, given their fluctuating nature throughout the study and over a longer follow-up period of a year. Coupled with ultrasound findings later in the study, a diagnosis of subclinical chronic pancreatitis in this cat seems probable. Interestingly, prednisolone treatment in this cat did not lead to a decrease in lipase levels. The researchers used anti-inflammatory doses of prednisolone in their study, which are typical for treating inflammatory conditions of the gastrointestinal tract or liver and biliary system in their hospital. They acknowledge that higher doses or longer treatment durations might have different effects, as some studies in dogs using immunosuppressive doses of corticosteroids have reported increases in lipase levels into the diagnostic range for pancreatitis. Finally, the researchers mention some limitations of their study, including the relatively small number of cats involved. However, they note that a statistical power analysis indicated that this sample size was sufficient to detect a meaningful effect if one existed. They also acknowledge that the cats were not fasted before blood samples were taken, which could potentially influence some laboratory results. However, they cite a recent study in dogs that found no increase in lipase activity due to prior food intake. Another limitation discussed is that blood samples were taken approximately 24 hours after the previous prednisolone dose, And while the drug's peak concentration and elimination half-life are relatively short, they cannot entirely rule out that measuring lipase at different times after administration might yield slightly different results. Nevertheless, they believe this aspect has limited clinical relevance because in real-world practice, there's always some variability in the timing of blood sampling relative to medication administration. In conclusion, this study provides valuable information for veterinarians by demonstrating that short-term treatment with anti-inflammatory doses of prednisolone does not significantly affect the common blood tests used to assess for pancreatitis in healthy cats. This knowledge can help in interpreting lipase results in cats receiving prednisolone for other conditions. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.